Hello, and welcome to Insight Workplace Health's training module on what is occupational health. In this session, we'll explore what occupational health actually is, the role it plays in keeping workplaces safe, healthy, and productive, and how our services support employers in making informed, confident decisions about staff well-being and capability. Why does occupational health matter? Occupational health is more than just a referral service. It's a strategic part of managing people well. Good occupational health input helps reduce sickness absence, supports early and sustained return to work, improves productivity, and reduces the risk of workplace disputes or legal claims. It also provides reassurance to employees that their health is taken seriously by the employer, encouraging a culture where well-being is openly discussed and supported. What do our services offer? Our occupational health services include case management, health assessment, workstation and ergonomic support, workplace needs assessment, and general advisory consultations. Each of these services aims to support both the individual and the organisation by giving clear and practical recommendations that help people perform their roles safely. Within occupational health, our teams consist of clinicians specialising in occupational health. Our clinicians use a biopsychosocial model of assessing employees, meaning that we consider physical health, psychological health, and any social or workplace factors that may be contributing to the issue. For example, someone experiencing back pain may also be affected by stress, caring responsibilities, or workload pressures. Bringing all of these factors together gives us a fuller picture and leads to more accurate and meaningful recommendations being made. Occupational health provide unbiased advice for both the employer and employee. Within case management, an employee is generally referred through a process of referral, appointment, generation of the report, and review with the employer. The process is designed to be simple, structured, and supportive. Occupational health receive the referral, gather clinical and occupational history, conduct the assessment, and produce a clear, outcome-focused report. If needed, we arrange a follow-up consultation. Let's consider a quick example. An employee struggling with anxiety may be experiencing concentration issues or frequent absence. Through referral and case management, we can explore what is contributing to the issue, assess fitness for work, and recommend appropriate adjustments, such as a phased return, workload modifications, or signposting for treatment by their GP or other providers. What happens in an occupational health consultation? An occupational health assessment isn't designed to diagnose conditions. That's the role of primary or secondary care. Our job is to understand how a condition impacts the employee's ability to work. We'll discuss symptoms, job demands, medication side effects, functional capacity and possible adjustments, and outline expected recovery times, all of which helps employers plan effectively. It will be important for employers to consider what questions they specifically need to be answered for each individual case, and for employers to be aware that confidential medical information will not necessarily be shared. Only information deemed relevant by the clinician and with the consent of the individual will be included in the report. What should you do once you have the report? Once the report has been received by the employer, it should be reviewed or discussed with the employee as soon as practicable, ideally within about 7 days. We support employees in a wide range of scenarios. Some common ones include mental health, those experiencing stress, anxiety, depression, burnout. These are incredibly common and benefit from early support. Musculoskeletal issues, those experiencing back or neck or shoulder pain or repetitive strain injuries. These often affect manual roles, but may also impact upon those undertaking desk-based activity too. Post-surgery or following injury. Supporting return to work planning after operations, fractures, or other medical procedures can be of great benefit to the employer and employee. For individuals who have serious illness or whose family members are suffering serious illness, where long-term conditions are impacting upon capacity or their inability to undertake their day-to-day job, a clear and frank discussion with the clinician can help establish likely timescales for return to work. For every scenario, our goal is the same: to provide clear, balanced guidance that supports the employer in keeping the employee in work or helping them to return to work. Fit notes are generally issued by GPs, and they may recommend some adjustments, but they rarely give detailed guidance about what someone can and cannot do in the context of a specific job. With knowledge of your workplace and working legislation, occupational health clinicians provide detailed guidance to employers, interpreting the medical information, symptoms that individuals may be experiencing, considering the job demands, and providing recommendations that are workplace specific, providing practical guidance to assist employers in workplace decision making. Signposting. Where appropriate, we can guide employees to mental health resources, counselling, or lifestyle support, and can provide early intervention support in the form of a brief report at the point of initial sickness absence if required. Wellbeing. Some employers wish to support their employees by providing additional wellbeing services. It's important to recognise that workplace wellbeing programmes are not a legal requirement, but they are becoming increasingly important for retention, morale, and improving absence management. Regular workplace wellbeing initiatives, whether they cover issues like sleep, nutrition, stress, or physical activity, can significantly improve employees' engagement and reduce sickness absence. A healthy workforce is a productive workforce, and even small steps to improve the health and well-being of your staff can have a noticeable effect on your absence rates. So in this video, we've covered the purpose of occupational health and explained that it is an advisory service which supports both employer and employee, how case management works, the types of scenarios we can assist with, and why occupational health plays a vital role in managing employees fairly and safely. If there is any further training you would like to request, or if you would like to have this session delivered face-to-face, please contact us at marketing@insightworkplacehealth.co.uk. In the next training session, we'll be looking in more detail at health surveillance, what it is, when it's required, and how to ensure your organisation meets the necessary statutory requirements. Thank you for watching this training video on what is occupational health.